Glad to welcome everyone. This is Dr. Vasyl Chaika, and today we'll talk about how to live after you've had your gallbladder removed. What should you do to avoid harming your other organs now? How can you eat normally? How should you organize your workday? What do you really need to do to maintain your health when you no longer have a gallbladder? Watch this video until the end, and you'll learn unique recommendations that almost no doctors talk about. Let's get started. So, when it has already come to the point where the gallbladder had to be removed and the person has undergone surgery, this could have been an open surgery, where the abdomen was cut open, or for example, a laparoscopic procedure where a few small incisions were made and the gallbladder was removed. And from this moment on, it feels like a catastrophe for the person, because the doctor now recommends a lifelong diet number 5, where you have to exclude fatty, fried, spicy, and bitter foods. Sour foods and all other products that, for example, you used to eat before are also off limits. Now you constantly have to be on strict diets and watch yourself, because now you have problems since you no longer have a gallbladder. Another thing is that after the same surgery, problems like pain in the right upper abdomen, nausea, diarrhea, and bloating often do not go away. In fact, they can even appear or become more frequent, and this happens quite often. Why does this happen? Let's break it down. And here's the first myth, which unfortunately doctors often keep quiet about: the belief that the gallbladder performs a very important function. You need to remember that the gallbladder is simply a reservoir where bile collects. Nothing more. It's not the gallbladder that produces bile, it's the liver that makes bile. And it doesn't matter whether you have a gallbladder or not, you still produce 1 to 2 liters of bile per day. And of course, if you had a gallbladder, then the bile that isn't needed because, for example, it's fatty, spicy, bitter, or sour, and the one that stimulates bile flow, this bile would drain into a certain reservoir where it would settle and concentrate, and when needed, it would be released and used. That's how it would be. But what happens when there is no gallbladder? Now a catastrophe has occurred, or so the doctor says. That's a mistake. What is the mistake? The mistake is that now the body begins to adapt. If there is no gallbladder, the body now uses the bile ducts as a reservoir to store bile, where essentially the same situation occurs as it did in the gallbladder. What? This is the concentration of bile, but of course the bile ducts cannot stretch as much as the gallbladder can. So as soon as the pressure in them rises too much, what happens? There is an immediate release of bile into the duodenum. And what does this lead to? To increased peristalsis and the onset of diarrhea. And this is also a very important feature, because people often make a mistake here by not eating properly. They stop consuming spicy, bitter, fatty, and sour foods, sticking to diets. This leads to even greater bile retention in the bile ducts. And what is the consequence of that? It's what I told you earlier. Diarrhea becomes more frequent. So now let's break down what you actually need to do, what mistakes you should avoid in order not to harm your body. So you should always start not with diets, not with some specific treatment, but first with restoring the normal functioning of our anatomy. And here it's very important for us that a certain valve, which separates the bile duct from the duodenum, works like clockwork, as they say. What is very important here? That after surgery, swelling often occurs there. Also, after any surgical intervention, a temporary paralysis of the intestines occurs. All of this leads to increased gas formation, slower movement of food through the intestines, and creates conditions in which this valve does not function as it should. Therefore, the first thing we need to do is create conditions so that this valve works as it did before. What do we need to use for this? So, the first thing we should start with is a specific method called visceral therapy. I will show you how you can literally, at home, or even after the 7th day following surgery, already start working with this valve. No complicated devices are needed for this. All you need are your hands, or for example, the same marker or felt tip pen. So now I will show you the technique for working with this valve. So, visceral therapy, for example, on the 7th day after surgery, you can already start doing it, and it is performed as follows. Here we have a person's abdomen, we have the right hypochondrium, here is the right costal arch, the left hypochondrium, the left costal arch, and here is the soft xiphoid process. the navel. Here in purple is the duodenum, here is the gallbladder and the common bile duct, and right here is the so-called sphincter of Oddi. This is the valve where the common bile duct opens, and as we recall, the pancreas is shown. So what do we need to do? We need to perform what's called a visceral massage. How is this done? It's done very simply by gently pressing, but you need to find this area. How do you find it? We take the tip of the xiphoid process, and here is the navel. We divide this distance into 3 equal segments. 1, 2, 3. And where the second third meets the third third, we move 1.5 to 2 centimeters to the right at most. And this area is the zone of the sphincter of Oddi. What do we do? With a gentle motion, we first press perpendicularly downward until we feel slight discomfort, and then, for example, change the angle to 45 degrees upward. And we hold until the pain sensation decreases. We hold for at least 30 seconds, up to a maximum of 90 seconds. This can be done on your own using your fingers, for example. This can also be done using a marker. Let me show you again. We press vertically downward at a 90-degree angle until we feel slight discomfort, and then we change the angle to 45 degrees toward the head and hold until the discomfort disappears. This will be the first point. The second point, it will be located 2 to 3 centimeters higher, and the third point is almost directly under the costal arch. So, by working through all these 3 points, you will be able to reduce gas formation in the duodenum and improve the function of the valve that regulates the flow of bile into the duodenum. This needs to be done daily. Once we've normalized the function of the valve, the next step is a specific diet, a certain regimen, and what is important here. So, previously the bile that was in the gallbladder was concentrated. It contained a lot of bile acids, which made it possible to effectively activate the enzymes of the pancreas. Now, when the bile is no longer as concentrated as it used to be, the pancreatic enzymes are not activated in the same amount. This needs to be taken into account. Because if you don't take this into account, what will happen? There will be constant diarrhea and continued bloating. That's why we need to mix our food well. Or rather, not just mix, but chew thoroughly. So, what needs to be done here? There's a golden rule I always mention. You should chew your food as many times as you have teeth. That is, don't rush your meals. Eat slowly, thoroughly breaking down your food. So try not to swallow your food whole like predators, as you might have done before when your gallbladder was working, but instead chew each bite at least 15, 20, or even 30 times. In other words, just eat more slowly. And that will be enough for you. Your food bolus will be moistened with saliva. This well-prepared food will then enter your stomach. It will be better moistened by enzymes, sorry, not enzymes, but specifically by hydrochloric acid. The food will be easier to process. This liquid mass will pass into the small intestine, and since our intestines are warm, it will be easier for the pancreatic enzymes to handle all of this. And there will be no bloating. The next very important point is that now you need to eat not once a day, as before, but since we no longer have a reservoir where bile was stored, and now it will only accumulate in the ducts, and the ducts cannot expand like the gallbladder, you will need to eat 4 to 6 times a day. This is what I keep repeating all the time. 3 main meals and 2 or 3 small snacks. And the next question arises, what should you eat? Probably diet number 5. No. You can eat everything just as you did before. You can eat fatty foods, you can eat spicy foods, you can eat sour foods, you can eat other foods. It doesn't matter what kind of food. Why? What matters is when you eat and how much you eat. That's all. Because if, for example, you stop eating fatty, spicy, bitter, and sour foods, this will lead to bile not being released. It will stagnate again in the ducts, in the bile ducts, and this will again lead to the formation of stones. Yes, stones form not only in the gallbladder. Few doctors talk about this, but stones also form in the liver ducts. That's why you need to eat this food. How much should you eat? A lot? No. Just enough for you to feel comfortable. If, as they say, you eat more than you need, you'll simply produce more bile and you'll get diarrhea. So that dose will be too much for you. So once again, you can eat spicy, bitter, and sour foods in an amount that's comfortable for you. You just need to figure out what that is. Another important point is that you shouldn't eat foods that cause bloating for you personally. How can you check this? For example, you eat some food and literally within half an hour to 2 hours, you start farting a lot. Or your stomach swells up and becomes like a barrel. This means that this food cannot be properly digested due to insufficient enzymes from your pancreas. So it doesn't suit you. But what will this lead to? It will increase the pressure in your intestines, and again, the valve, the one that separates the duodenum from the bile ducts, won't open properly, and there will be stagnation again. And these symptoms that you often experience, what are they? Diarrhea, then bitterness in the mouth, then pain again in the right upper abdomen, and so on. They will keep recurring. It doesn't even matter that your gallbladder has been removed. So, by following these simple recommendations, you can continue living as you did before. And what is also very important is that people often say it's the bile that causes irritation of the intestines afterwards. Please remember, bile never causes irritation of the gastrointestinal tract. On the contrary, bile stimulates the contractions of the gastrointestinal tract, creates conditions that prevent any helminthic invasions, and fosters an environment where bifidobacteria, lactobacilli, and other beneficial bacteria can thrive, while pathogenic flora cannot survive there. It improves digestion by activating pancreatic enzymes. If you can't consume spicy, bitter, or sour foods, you can use regular herbal remedies. Which ones? These are the ones that stimulate bile flow. For example, bitter herbs. If you can't take bitter herbs, then you can use a common herb, such as tea called agrimony. If you've had your gallbladder removed, you take 1 tea bag, brew it like tea once a day. And that's enough. So, the conclusion is very simple. Knowing that you are able to perform visceral therapy, that you chew your food well, that you eat 4 to 6 times a day, and avoid foods that cause bloating, nothing else in your life will need to change. That is, you can live peacefully and enjoy life just as you did before. This was Dr. Vasyl Chaika with you. See you next time.